Hi, everyone. Welcome to our Fifth Window Spotlight. I am Charlene Platon, CEO and co-founder of Fifth Window, and we are so excited to share today's spotlight and talk about a lot of great topics surrounding mental well-being. And so before we get started, just wanted to do some introductions for our team. So I'd like to introduce Kathy.
Hi, everyone. Kathy Schaefer here, co-founder of Fifth Window. I am also a registered nurse, a certified compassion fatigue professional, and a population health nurse.
Amazing. And I'll go ahead and turn it over to you, Kathy, to introduce our guest speaker.
Thank you so much, Charlene. Well, today we are really excited to have with us Dr. Jonathan Llamas, who is a DNP, registered nurse board certified, a psychiatric mental health nurse practitioner board certified, and a public health nurse. He is highly acclaimed board psychiatric mental health practitioner and a distinguished nurse leader and a preeminent mental health nurse expert based in Los Angeles, California. He is passionate about empowering the future generation of nurses and healthcare providers and is the founder of Mind and Heart, a mental health brand dedicated to spreading love through positivity through inspirational stories, positive messaging, and brand merchandising. For his outstanding work and clinical contributions, Dr. Llamas has received numerous awards and recently was named the 2023 Nurse Leader of the Year, Icon of the Year by Nurse.org. Dr. Llamas strongly believes in the importance of leaving the world a better place than we have found it and makes his lifelong mission to not only use his platform as a source of good, but also inspire others to be authors of their own great stories of greatness. Welcome, Jonathan.
Thank you so much for having me, Kathy and Charlene.
That's great. So, Jonathan, you have had multiple roles on your journey in nursing as a psychiatric nurse practitioner and a nurse leader. But can you first tell us about your journey to becoming a nurse as well as a psychiatric nurse practitioner, and maybe like what kind of led you to that path?
Yeah, that's a really good question. In terms of my own personal journey, it started off actually during my senior year in high school. During that point in my life, I wasn't quite sure what I wanted to major in college, but obviously growing up in a predominantly Filipino family, you were exposed to a lot of people working in the healthcare, primarily nurses. And even though I actually enjoyed and was very passionate about like working in theater, like performing in theater and the performing arts and everything like that, I knew down the line that I wanted to do something that was bigger than myself. And so nursing was something that naturally interested me. But obviously, as both of you are aware, nursing is not a very easy major to take part in. And so when I applied to nursing school initially, I didn't really have the right mindset or the right mentality going into it. So I didn't really understand the importance of prioritizing and making sure that you're setting time aside for studying and stuff like that, to the point where, unfortunately my GPA got really, really low. I think it was below 2.0, if you can believe that. And it got to the point where the school had to essentially kick me out because they said that I wasn't meeting the grades needed to be successful in the program, right? So at that time I was 17 years old. And so I told myself, okay, well, maybe I might need to go an alternate route. So I started looking at my local community colleges, and I needed to complete a lot of the prerequisites still in order for me to get into the nursing program. And so I did, but it was with the mentality still that C's get degrees. And again, as you guys are aware, in nursing school, that you can't have that mentality because it's a very competitive program, right? And I didn't even know actually in community colleges that it's even more competitive because of the fact that there's very minimal slots available, right? So once I completed a lot of my prerequisites, it got to the point where the majority of my classes that I finished all ended up being around a C or B average. And it got to the point when I needed to apply now to the nursing program. I spoke with my counselor, and then she actually flat out told me, you need to switch majors. You're not going to be successful here. You don't have what it takes, plain and simple. So I think you should just like quit while you're ahead and just kind of figure out something else. And so you can imagine someone who's around that age, around 18, 19 years old, you could have gone either route, right? You could have listened to this person. Like you could have said to yourself, you know what, she's right. Like, who am I kidding? Like, I'm not cut out for this. But there was just something inside of me that just felt that, I don't know, there's just something that was kind of pushing me forward and to telling myself to not give up. And one of my biggest protective factors actually is kind of like how I was brought up by my parents, especially my mom and my dad. They instilled a very faith-driven value in me, and it was one of those things that really helped me really center myself and ground myself. So with that being said, I really dug deep and I used my faith as a way to kind of lift me up. And I asked myself simply, like, is this the best that I can do? Am I really giving it my all? Am I really giving it my maximum effort? And it was at that realization I realized that wasn't the case. And so I made a promise to myself that if I was ever given another opportunity, that I was really going to give my best effort and we'll see what happens. So I looked all around to different programs. I stumbled across, West Coast University. They gave me a second opportunity. And at that time, I actually applied myself. I actually made the sacrifices needed in order for me to do well. And, before you knew it, I was actually getting good grades. I was getting A's in my classes, biochemistry, mathematics. These are classes that I was very weak at, believe it or not. I was never actually, I guess, naturally gifted in those type of sciences or subjects. But understanding and seeing that if I'm giving the maximum effort, that I can achieve anything, that really instilled a lot of confidence in me to the point where, I graduated in 2013 with my bachelor's degree in nursing. I was able to maintain a 3.83 GPA, which is huge for me. I've never maintained any GPA as high as that before. And so I can remember seeing my parents crying. I could see myself crying walking up on that stage and just kind of looking back at my journey and kind of understanding that it's not how you start, but it's how you finish that will really determine kind of like the trajectory of your life. And I've used that ever since in everything that I do.
Oh, thank you so much for sharing your story. And I just want to applaud you for being so vulnerable
Yeah.
because I think, so I am a nursing professor and, I have a lot of students who sometimes come with different types of backgrounds, however they were, their previous education was, and maybe they were super stellar students, but they get to nursing and it's challenging and they struggle, or maybe they didn't have a great foundation and they really want to be a nurse, but they struggle. And, when you don't do well and, I think the three of us, and Charlene and I have shared this before, we all have the same thing in common. We didn't start out as a straight A, this is what I wanted to do, and we just became stellar. We all stumbled and struggled. And I think it's really important, especially for new practice nurses who are coming into, or young people who see, oh, I'm not a great high school student, but I want to do this, that, you can do it. Yeah, you might stumble, but just like you said, you had a great family support system that, just said, okay, let's pick ourselves up. And I think when you then have that mentality, like, I'm doing this for me, you take ownership of your education. And I think that's a big piece to get across to, especially the youth who are coming out of the pandemic. And they didn't have a great foundation of, the last couple of years or even the beginning of years of education. So thank you so much for sharing your journey with us. So you're a psychiatric nurse practitioner. And can you just describe your clinical practice or your clinical focus to us? A few months ago, we had Lavender on our platform, and they're a nurse-led telehealth platform. So maybe you can also share how you might be the same or different in similar work that you all do.
So, like you mentioned, Lavender, I think they're doing really great things. I think it's really awesome to kind of hear about an organization that is, NP led. And I think that especially in today's society, when we think about the medical model and the medical team in general, of course, there's still people who are maybe grew up in a different time where they think of it as kind of like a hierarchy type of model. But I think now in today's day and age, I think we view it more like a roundtable type of situation where no one is trying to replace anyone. And I think that everyone has their own unique experiences and valuable contributions that could bring to the table, because at the end of the day, we're all part of the same team. Right. At the end of the day, the one in the center is the patient, and we all want to make sure that we're doing what we can to help serve the patient as best as possible. So in terms of kind of like how we function in terms of my specific practice, it's a private outpatient practice. And so the patient population I typically see is the adult population. So from 18 to around like 65, 66 years old. I'm very fortunate in the fact that it's a very collaborative type of approach. Obviously we still have our supervising / collaborative physicians that we work with, but I've been very fortunate that the physician that I'm working with is very collaborative with me. We work together. There's no sense of, I'm better than you because I have an MD versus you have your DNP. None like that. And I think a lot of it also shows that, especially in the field that we're in, if you know that you are doing things properly, that you are keeping yourself educated, that you are advancing your education, and that you're being proactive in your approach, and you're showing them that you're doing the best clinical practice based on evidence, everything like that, a lot of our physician counterparts will notice. I think a lot of them, again, are not really quite familiar in terms of maybe the nursing model or kind of like how we're taught, but it is our duty and our obligation to kind of explain to them, this is how we do things. And because I think for nursing specifically, we have a very unique perspective, right? Because we're pretty much with the patient 24/7. We were with them either 8 hours a day, 12 hours a day shift, right? And so I think that gives us some valuable insight in terms of just really setting or noticing the nuances that sometimes a lot of the physicians might not recognize because of the fact that we are so closely tied with the patient. So I think as nurse practitioners, especially in psychiatry, that's very important too, because in a lot of the symptoms in psychiatry sometimes can go under the radar. And just because someone's depressed doesn't mean that it's just strictly depression. We have to also understand there might be other things that are underlying that's fueling that depression. And so with that being said, I try to keep that holistic mindset at the forefront of my brain every time I try to work with my patients.
You bring up a great point or you said, nursing is always holistic. It always has been holistic.
Yeah.
And having that viewpoint when you're looking at the multiple dimensions, because it's not just one thing that impacts someone's health, well-being, engagement in care. There's multiple factors. And I think nurses have always known that, have always seen that. And I love also that you are really a big proponent of educating non-nurse providers of what you do in your specialty, and what we can do collaboratively to care for people and make them well and make them better. So, which brings me to, that's a great piece of leadership. Nurses are natural leaders, and I think that's a wonderful piece to have. Tell us about your journey into leadership. Like, how did that start? Where did that begin? Like, do you feel that you're a natural born leader, or did it have to take a little practice?
I mean, that's a really good question. I don't know if there's people out there who just naturally feel that they're born as leaders. For me personally, I feel like leadership is something that is created over time, right? And I think that even though we are given different opportunities and different circumstances, it all ultimately depends on the individual and how they choose to become, or how they choose to whether or not they want to become emotionally resilient or victims of their circumstances. Right. So in terms of me and how I like to view things, again, a lot of it is strongly rooted in the fact that, again, I'm very fortunate to have that upbringing that my parents kind of instilled in me at an early age, because knowing that there's something out there bigger than myself, knowing that I'm standing for something that is bigger than myself in a sense in terms of the nursing profession and what we stand for. I think that really helps kind of propel me forward, because I know that at the end of the day, I can't take anything physical with me, when we pass away, but what I can do is hopefully leave a lasting legacy that can make a positive impact on the people around me. So when it comes to leadership, one of the things that I've always come to recognize and realize is that leadership is only possible through transformational change, and change is not possible without growth. And the only way that we can grow is if we learn from our mistakes. And I think, again, going through the adversities that I've had to go through, not being afraid of failure, understanding that failure is a part of success, and not the opposite of that. I think that also has given me the confidence to not be afraid to try. And I think that a lot of times people are afraid to try because they think that if they fail, then that's it for them. But in reality, a lot of the most successful people are the people who's failed the most. And so I think that we need to kind of shift that perspective a little bit and understand that sometimes just trying and not giving up until you hopefully see the results that you want, that will ultimately determine whether or not you're a leader.
Yeah, I can resonate with that so well. I also think about how when we bring students into nursing programs, the first thing we tell them is about this big test at the end of their schooling, and it's do or die,
Yeah.
pass or fail. Like, you become a nurse, you don't become a nurse. So we've already set them up to believe that they don't have the ability to ever fail, right? They can't take chances. They can't move outside of the box. But I so appreciate you, sharing again. I think young nurses have to hear this from us who have been in the trenches for so long, that we've all learned the same way, that by failing or falling down or making a mistake and acknowledging it and then growing from it only makes us better and stronger. But you've had to have had some sort of characteristics in you to be a leader, because you received the 2023 Icon of the Year and Nurse Leader of the Year from nursing.org. There's got to be something built inside of you. What does that mean to you? Like, what does that represent on your journey? Is it a validation?
I mean, it's a huge honor, first and foremost. I never thought in my wildest dreams that I would ever have an award or honor like this in my entire life. And so I've always been taught to be, humble in victory, gracious in defeat. And again, a lot of it, especially this, is it's a win for the nursing profession as a whole. I think seeing someone as a person of color, also as a male nurse, and then having this award, I think kind of shows just kind of the progress that we've made as a nursing profession. And again, it's not about me, it's about everyone who's came before me, the people who's mentored me along the way, my nursing friends, the colleagues that I've built, the friendships that I've developed over time, the patients that I've had an opportunity and the privilege to be able to take care for. Those are the people that I really want to hopefully bring that spotlight to, again, because it takes a village, right? It's not about me. And so it's one of those things that, again, I'm very humbled with, I'm very thankful for, but hopefully when people see me, when people hear my story, they can see maybe themselves in me and make them realize that, hey, if he can do it, then I can do it too.
Absolutely. I agree with that 100%. We always need and look for people who look like us,
Hmm.
so that we can say, look, they did it, we can achieve it too. And so you being receiving the 2023, Nurse Icon of the Year award represents so many things to so many different people. And I think that's just awesome, given today that we're trying to get more nurses representing the population at large to be
Hmm.
practicing at the bedside in the community and in psych and that. So speaking of the nurses, this Nurse Icon Award and the nurse at large, you have a really impressive social media following. You have like over 153 followers on Instagram alone.
Hmm.
What's it like to have such a big, huge like social media presence as a nurse?
Again, it's it's one of those things that I'm still very blown away by. Just the fact that people would be willing to follow me in my journey and would love to hear what I have to say. But again, it's when I first started my Instagram, I think in 2013, 2014, around that time, I don't think any of us knew just how impactful Instagram or social media can be, right? And the type of platform that it can provide for a lot of us in terms of showing people what we can do and showing people kind of like behind the scenes in terms of what needs to be done in order for us to get into where we are right now. And so again, I try not to focus anything on the numbers. The numbers are great, but at the end of the day, I've always found that what matters more is that if you have like a meaningful message that you're trying to convey, right? If you're standing for something bigger than yourself. And for me, my platform has always been trying to empower people, to try to inspire people that they are that they have more than maybe that they might consider that they might have, basically, right? I think a great leader is not showing people your superpowers, but showing their other people their superpowers and making them realize that they have more potential that they give themselves credit for. So that's what my platform is just pretty much trying to be, and hopefully shed some light as well in terms of DNP prepared nurses, psychiatric nurse practitioners, and trying to at least educate, like you said, the public and a little bit more what we do. And that for me is a huge honor, because I've always tried to maintain the highest level of professionalism, because again, I know I'm carrying the nursing profession every time I speak, every time I kind of post something on there. And so I want to be mindful of that, and I want to make sure that I do it proudly as well.
Yeah, we have a lot of things in common regarding being nurse entrepreneurs.
Hmm.
You're a nurse entrepreneur, we're nurse entrepreneurs, and we have a lot of nurse entrepreneur followers. And I'm sure there's a lot of our audience who is wondering, just how did you get to 153,000 Instagram followers?
I mean, it's one of those things where again, it's happened over the course of what, almost 10, like pretty much 10 years, right?
Mhm.
So it's one of those things that I think that if you are doing, if you have a meaningful message that you're trying to convey, if you're trying to be authentic and genuine in terms of the values that you're trying to show others, the followers will eventually come. I think people really are drawn to the integrity side of it. There's unfortunately a lot of profiles out there that may not be as genuine. Maybe they're more focused on the superficial things. But if people can sense that you are trying to do something more meaningful, then I think that's going to translate down the line in terms of numbers. But again, what I'm looking for more is engagement, right? So it doesn't really matter if you have like 1 million followers, but if maybe only 100 people out of those 1 million is actually engaging with your content, it doesn't matter, versus maybe someone who has 1,000 followers and like 200, 300, 400 people are engaging. I mean, you're doing, in my opinion, better than the one who has 1 million followers, right? So it's how we shift and how we kind of like view things. But yeah, the engagement piece is the one that I try to focus on the most.
Yeah, that's a great piece to let us know. Charlene, did you have anything to say?
Yeah, I
I'm
just wanted to
sorry.
say, oh yeah, yeah, sorry. I just wanted to say in the chat too, we have several nurses who have been joining in on the conversation, and they just have a lot of kudos to share with you. You know, the congratulations on your recognitions with nurse.org, and then also just echoing what you said about representation and how that's so important, how that matters. And then I just want to acknowledge Farah's comment. She said at a conference that she attended recently, they were mentioning about how engineers say to fail fast, so you could keep moving forward and learn. So I think all of these just really echo what you had mentioned earlier about the journey, and I think just also acknowledging that it takes time, right? It's not a I think people think it's an overnight thing at times, but it's really great to hear from your perspective of how long the journey is and how much work goes into it. So thank you for sharing that,
Of
and just
course.
wanted to share those kudos.
Yeah, I was also thinking about how, as nurses, we almost kind of have an obligation when we engage with people, and especially in today's day and age, in the social media platforms, there
Mhm.
is a lot of false information or information that is not safe. And I
Mm.
think as nurses, and what you're doing, especially in the mental health area, to be able to create, and provide education in
Mm.
regards to what we do as nurses. And this is how we should go about doing it. I just this morning saw one of your Instagram posts. We were talking about, as a new nurse practitioner, psychiatric NP, 3 things that you can do for your patient. And you talked about listening and patient engagement, and don't quickly, be so quick to prescribe because you just got a license. And I thought to myself, those are great things to hear, right? And coming from someone who is as knowledgeable as you are with the credentials, and you're using your platform in the right way, only helps the rest of us who are in that space of being an entrepreneur as a nurse to have more, validity in what we say. So thank you for keeping it honest and real and engaging with your followers. And so, as we all are nurse entrepreneurs, you actually are a founder yourself. You started a business called Mind and Heart Mental Health, and it's a
Mm.
brand. So, what led you to start this brand? And can you share some of that brand with us? Like, what is it, and what's the journey that you've been on?
So it's funny because I've always been someone who's interested in fashion. I've always been someone who's interested in kind of like the creative aspects of things, and I'm a visual learner. And one of the things that I found has helped me growing up is whenever I would see something visually beautiful or uplifting or things that inspires me, it kind of instills an emotion inside of you that you can't really describe, right? I'm sure all of us have experienced that at some point in our lives. And so I wanted to create something that, in a way, when people see it, it kind of delivers the message across in terms of better understanding and being more empathetic about kind of like the mental health journey, how it looks different for everyone, and that everyone's symptoms or mental health journey is going to be different. So I wanted to hopefully create a brand that kind of shares that, or that kind of conveys that message. And so I've kind of connected my creative side and my love of fashion and love of positive messaging and kind of illustrations, and kind of blended my passion and my purpose in terms of working in the psychiatric field and working as a psychiatric nurse practitioner and kind of blended it into one. And so a result of that is Mind and Heart. And so it's pretty much a brand that is focused on mental well-being, kind of sharing positive messages, using those messages to kind of uplift people. And again, there's a lot of things in the woodworks. Hopefully I can make a podcast as well down the line to kind of highlight the importance of mental health, but also kind of like having those conversations from people who actually have like maybe depression or anxiety, and versus someone who's on the more provider side. So there's a lot of different things that I would like to do with this, but for right now, it's just kind of blending and merging my two passions, which is like the arts and the creative, and then with kind of like the logical, or like the mind part, which is kind of like my nursing background and everything like that. So that's why my hashtag is like where passion meets purpose, essentially.
Great hashtag.
Yeah.
Great hashtag. So we have more things in common than you can imagine. Besides our love of history, I have a fashion degree as my first degree. Nursing is my second degree. But
Yeah.
I will share with you that I think that those two, because people always say, how could those two possibly go together? But we all know that nursing, we have to be creative.
Yeah.
We always have to be thinking on the spot, because it's not just cookie cutter for every person we engage with. And I think that creative side that you have, that you share with us, and I think there's a lot of nurses who have that creative side, don't realize that you need that piece. When when Farah in the comments section said that engineers fail fast. I teach a course called Design Thinking for nurses. And I tell my students, you got to fail fast and hard and get up and keep going. And so I think that's where sometimes nurses get stuck. They take it personally when it fails, but you say, that's the learning opportunity. And I love that you are using your creative side with your logic side, you said, and you're creating something for a population, and I speak from population, but you're for a group of people who will be able to connect with it. And I think as entrepreneurs, we're always finding who is our end user, right? And I think that's great that you brought that. I just think that sometimes nurses feel like they're just so stuck in a box, right?
Yeah.
And you say, no, there's just so much more. You just think beyond the box, and you can't imagine what you can do with that. So let's talk about your logic side and your love for mental health. How do you define mental health, and what does it mean to you?
That's a really good question. I think for me, mental health is total health. And I guess I'll explain it in this way. I feel like mental health and physical health is interconnected, right? So I don't think it's separate. I think oftentimes people try to separate mental health versus their physical health. But, for example, if you are, in pain physically, it's hard for me to believe that mentally that you're going to be okay, right? Mentally, I'm sure you're also going to be in mental distress because of the fact that the physical pain is there. And vice versa, if you are anxious or if you are having a panic attack, your body is going to physiologically respond to that, right? So there's an interconnectedness there that I think more people have to understand. It's not a separation in terms of mental health versus physical health, but it's total health. And I think for me, specifically with mental health, and again, with how we were taught, right, through the nursing model and through that holistic approach, it's one of those things that I really try to kind of hone in with my patients and try to continue to educate them on, right? Because oftentimes patients will be wanting medications right away, but I'm always trying to ask them specific questions like, well, what is fueling your depression? Is there anything that's causing you any stress? I mean, what is going on in your home life, in your work life, in your personal relationships, right? I mean, are you exercising? Are you doing all these things? And 96% of the time, there's always maybe 1, 2, or 3 of these factors that people are maybe forgetting that they need to do better on, right? They need to improve upon. So with that being said, it's one of those things where when I view mental health, I think of it like in a very holistic and totality type of perspective. And I think that having that approach really makes a huge difference, because I think if you are viewing it in that way, then the likelihood for success is a lot higher.
That's a nice perspective to have, a nice viewpoint to have. I think that's wonderful when you look at the whole dimension. Fifth window, we look at 5 dimensions of self-care. And so I think you're absolutely right. One cannot be impacted without the other being affected. When it's kind of like that cogs wheel, when one is pushed, the rest of the cogs move. But if a cog is stopped, then the rest of the parts stop. So I do think that people often feel, if you just fix this one piece, I'm going to be okay. And you have to share with them, well, there may be more things that can be impacted. I might fix this piece, but what's it going to do down the line for you? So that's wonderful. And you take care of people probably every day, and you engage with your followers on Instagram. But what do you do to manage your mental health, especially as a psychiatric provider?
Mhm. Yeah, so that's again another really good question. I think for nurses, for providers in general, people working in healthcare, I mean, we know firsthand just how challenging and demanding it can be, right? Not just physically, but also emotionally and mentally as well. So I'm a firm believer that we need to develop protective factors or things that we feel can help us decompress in a sense. And for me, I have a few which I'm very thankful for. Obviously I like to exercise. Running is one of my go-tos in terms of helping alleviate some of that pent-up energy I may have. It really helps kind of alleviate some of my anxiety and stress, especially if you have a very long work week. So physical exercise is always very helpful. Prayer and faith, meditation, these things are also that keeps me grounded, helps me understand that our best is going to look different every day, right? Some days you have 60%, and if you give 60%, it doesn't mean that you have 40% more to give, because if 60% is all you got, then that's all you got, right? And I think a lot of us, we beat ourselves up because we're telling ourselves, well, we should be giving more. But if we don't have more to give, then we should give ourselves more grace in that opinion. So also just kind of like having that mindset, and that helps gives myself the grace and to not be so hard on ourselves, because obviously we always want the best for our patients, but if we don't see the results right away, sometimes we personalize it, even though we might not want to, right? And so one of the things that has also helped me is to continue to just focus on giving the best effort that I can. If I know that I'm giving everything that I can each and every day, then I know that down the line the results will eventually come. And so just kind of shifting your perspective on more effort oriented versus results oriented, that also helps a lot. And again, surrounding yourself with the right people, making sure that that your village and the team around you are all supportive. I mean, that also kind of helps, right? To have a sounding board, or if you do to have a therapist, I always recommend everyone, therapy is not just for our patients, it's also for us as well, right? Because we're all human. We need some people to talk to as well. And so whatever it is that you feel is going to help you, that's what I always try to encourage people to do.
Yeah, you bring up a great point. When I think when we talk or when we use the words, it's okay for you to
Yeah.
seek therapy, right? Yeah. I don't think people ever tell nurses that it's okay not to be
Mm.
okay, right?
Mm.
We tell them, especially during the pandemic, pull up your bootstraps, put on your N95, and just keep going. Eventually it's going to be okay. And so it's hard when you turn the table around and you say to nurses, no, it's okay not to be okay. And I really appreciate the fact that you say that if you give 60% some days, and if you give 100 another day, and even if you give 10% another day, that's okay. Because I always tell, I do some peer support group for the nurses in the hospital as well. And what I tell the nurses is that you have to understand this, that your best is good enough.
Yeah.
If you did your best, it is good enough. The results may have not been what you wanted it to be, but and I can't tell you how many of them find that so hard to even say to themselves in a mirror. There's just this wall that won't allow them to just say it to themselves. So I like the idea where you say that you do some mindfulness and you do some meditation. Do you do that on a daily basis? Is there one self-care practice you do on a daily basis?
I'm gonna be honest with you. I mean, like, of course, there's gonna be days where you just forget, and that's okay. I try to do it as often as I can, but sometimes work and life gets in the way. But the one thing that I have found that has really helped me, the bare minimum, is just making sure that I get enough sleep. I think just getting enough sleep. I think sleep is super underrated. I think a lot of people don't really recognize just how impactful sleep can be. So if I don't do anything else, but I make sure I at least get my 7 to 8 hours of sleep a night, then I know that I'll be okay. Because sleep is really one of those phases that can be very restorative, right? Because it can help really kind of clean up a lot of the gunk that is built up in our brains over the course of the day. And so that is something that I at least try to aim for, bare minimum, if I can't seem to do anything else.
You're coming out with some wonderful, great responses, and you're giving us great insight, because I'm going to tell you why I think what you just said is even more important than anything you said all day, all
Yeah,
morning with
yeah,
us.
yeah,
When you said you're going to be honest, that some days you don't do anything at all, and
yeah,
that's okay.
yeah.
I mean, how many of us have been, again, influenced by somebody who says, you wake up and you journal in your journal every day, and you
Mm,
drink your 8 ounces, your 8 cups of water, and you go for your 10,000 steps. And then
yeah.
there's that one day you don't do it. And you go right back to, I feel like a failure. I can't even take care of myself.
Mm,
How am I going to take care of somebody else? So I so appreciate that you are giving us the permission,
mhm,
right? Because you're saying it,
mhm.
you're giving us the permission to say, okay, so here's your 10%. You didn't do it today, but maybe tomorrow when you wake up, when you put your feet on the ground, you just say, thank you for letting me open my eyes today. And okay. And that's, you get right back on, the bicycle or the horse or whatever phrase you want to use. Right.
Yeah.
And you try again. And I love, and I appreciate, and I think, again, coming from someone who's in the mental health space, to give someone permission that
Mhm,
it's okay, you don't get it right every day,
mhm.
that you're not a failure, you keep on trying, that I think it resonates a little bit more with me. I think it makes it feel like, oh, well, if Jonathan says it's okay that I didn't meditate today, then maybe it's not so bad that I
Mhm.
didn't meditate today. So I so appreciate that. And so,
I
are
want
there
to add to
any?
that
Oh,
too,
go ahead.
actually.
Yeah.
And I think, and thank you for sharing that too, because I think when it comes to nurses, we tend to have this black or white thinking. It's either you did everything perfectly or you're a complete failure.
Mhm,
And I
mhm.
think that shows up with our mental health and our self-care practices. So I think just to acknowledge that there definitely is a gray, and there's definitely days where, you things don't go 100% perfect, and that's totally fine. It's not the end of the world. I think that since there's so many high performing, perfectionists that are in the healthcare space, it's really hard to kind of think of anything in between.
Mhm.
But just wanted to share, just to acknowledge that because it's really important. So,
Sure.
so thank you for doing that.
Absolutely, absolutely. And so, you touched a little bit upon this, Jonathan, of why mental health is important for nurses, right? And what types of advice can you give, especially our new to practice nurses who we know are coming out and within 3 years are leaving the field? I mean, and the pandemic has just made it worse. And the nursing shortage that happened before the pandemic is now really stressing, nursing units and floors and practices. And what kind of advice can you give our new to practice nurses to keep them still fresh and want to be here, but also our seasoned nurses who we don't want them to leave the bedside or practice just yet?
Mhm. Again, that's a really good question. And in terms of that, I guess my biggest piece of advice is to really take a step back, right? Especially if you're starting to feel overwhelmed or burnt out, and kind of reevaluate, right? I mean, and try to understand and kind of ask yourself that question. I mean, like, what brought you into nursing in the first place? I think when myself and you guys as well, when we both entered the nursing, when we all entered nursing profession, and we all came in at various times throughout our lives, right? And during our time when we went to school, I mean, we didn't have a global pandemic that we had to worry about. So I can only imagine the people who had to go through school during 2020, 2021, and now 2023, what they've had to go through. I don't think we'll ever understand just how challenging it was to be able to learn clinicals and to be able to take care of patients virtually or through simulation labs and not really having that kind of educational training that we were all accustomed to. And so, with that being said, it's really number one, understanding that we'll never fully know like the challenges that they've had to face, but also for the people who's been working as seasoned nurses for a long time. Um, Again, it's time for us to kind of reevaluate. Like, is this what we're doing right now? Does this still align with who we are, who we've become throughout the course of this pandemic, and whether or not this is still something that we want to be, right? Because at the end of the day, how I view it is that, again, my main goal is, even though nursing, obviously, we know is a job, right? As nice how it is to be able to talk about like, I want to do something good in the world. We all know at the end of the day, it's still a job, right? And so we are the ones who's carrying a lot of that burden as well. So in order for us to really serve our patients fully, we have to be honest with ourselves, and if we need to let's say take a break, that's okay. If you need to take time away from nursing, the great thing about the nursing profession now, there's so many different opportunities. You can, you don't have to work directly in patient care. If you want to dabble into other things through nurse entrepreneurship, if you want to do nurse education, if you want to be a nurse writer, or there's different fields that you can even try to see and see if that might help kind of spark kind of that passion again that you've once had for nursing. Again, for all of us as well, I think the great thing about nurses is that we have so many other likes and interests outside of taking care of people and being a nurse. And so just making sure if you have other things that that helps fill your cup in a sense, whether it's like I said, like education, whether it's doing podcasts, starting a business, or doing something completely different, that's okay. Because we're not just meant to fit in this specific box, right? We need to get ourselves out of that box and understand that we can be just as great as a nurse, but we can also do something else on this side as well,
It sounds to me that you are a big mental health wellness advocate. So how can we, or how can, as Fifth Window, advocate for more nurse mental wellness? How could we as nurses advocate for ourselves, for our mental health, our mental wellness? How do you think we can do that?
I think number one, first and foremost, is to continue to communicate. I think communication is key. And when you communicate, you need to make sure that you are really being, clear in terms of what it is that you need, right? Because everyone's needs are going to be different. So if you need to reduce your hours at work, if you feel like you need to find ways to kind of maybe change your nursing schedule or whatever case that you need, make sure that you're clear with that and you set those boundaries as well. There's no point in setting those expectations, but then if your boundaries are pretty much blurred and flexible, then you're not really advocating for yourself, right? Because you have to be firm in what you believe in and what will work for you. So I think that's why I think for you guys, for Fifth Window, I think it's amazing that you are bringing more awareness into nurses' well-being and their mental health, because again, it's something that we need to continue to practice and apply to our own lives, and not just something that we say to others and we don't do it ourselves. And so for me, to be honest with you, I only work 30 hours a week, to be honest. And the reason why I do that is because of the fact that I know that if I work that extra 10 hours, that I won't be able to give my patients like 100% of myself. And I think that it'd be such a disservice to not be able to give my patient 100% of myself. And people ask me, well, then aren't you losing money? So what? At the end of the day, money. I know that money is, everyone is stressed out about money, but at the end of the day, like my mental health and well-being is much more important, because I'm not here just for 1, 2 years, 3 years in the field. I'm here hopefully for as long as I'm still able to live and provide care. That's what I'm looking more long term. And so if I'm working only 3 10-hour days out of the week, but I'm using the rest of my time building, kind of like being an advocate for mental health, using my platform, doing podcasts, speaking, whatever the case may be, I mean, that to me is also a good use of your time, right? And it doesn't have to always necessarily equate to money. And so that's why I want to share that with people, to not always just be so focused on the bottom line with the money. I know it's important, but try to focus more on yourself. If you invest in yourself, then anything is possible.
Yeah, and one of our listeners in the audience, Farah, just is commenting that reinforcing or enforcing boundaries both in our personal and professional lives is really about advocacy, right?
Yeah.
Okay, so let's be honest here, Jonathan. This is a one-sided conversation because we're the nurses, right?
Yeah.
But there's two people in the conversation in order to maintain our mental wellness. How could we approach the other side in this two-way conversation, meaning administration, hospitals, healthcare systems? How can we approach them and maybe start having a better dialogue so that if I am setting boundaries, you need to observe and respect the boundaries that I'm creating. So sometimes we have to give nurses the dialogue until they develop their own dialogue. So what can we say? What can we do?
Again, that's another really great question. In terms of how I would approach it, I guess in terms of work, obviously there's always going to be a disconnect, especially for people who are working in management, administration. They don't necessarily see what we do on a day-by-day basis. So I would definitely advocate for more kind of like, work like behind the scenes, or work with me day or whatever case may be, where they can just maybe shadow us for like a full day and actually see kind of like our day by day kind of processes, see what we actually undergo, because people won't know the journey that you're on unless you walk in a mile in their shoes, right? As cliche as that
Mm-hmm.
sounds, but it's very, very true. And I think it's also helpful for us to walk in their shoes, see what they have to do, because then it's easy for us to kind of say our jobs are very difficult, but we don't know what they're also facing on their end of the spectrum, right? So I think being able to kind of see what they do behind the scenes, maybe shadow them, or have those opportunities where we can shadow our colleagues in different parts of the healthcare system, I think that will help communicate and facilitate those conversations much more easily, because then we have a somewhat of an understanding, even if it's something just brief. At least it gives us some understanding of what they're going through, and so helps kind of build up that empathy for one another.
Great advice. I don't, we always think about giving them the tools or the words to say, but earlier in our conversation, you used the word grace,
Mhm,
which I find is a very empowering word.
mhm,
I understand where you're coming from. I'm going to ask you to understand where I come from, and that's the space of grace.
mhm.
And then we can have a better conversation, right? It may
Yeah.
not be immediate that things get changed, but maybe there's more advocacy from someone who has a little bit more of a leadership or authority who could advocate on our behalf if
Mhm,
they understood, right? Because the whole goal is to stop the hemorrhaging that is happening, right? Which is everyone is leaving nursing at a rapid rate, and ultimately, it's patients, it's people that we're caring for. They're the ultimate ones that really do suffer because there's none of us around to take care of them, or or we're so burnt out that we don't really engage fully when we care for them, right? So I appreciate that so much, and everything that you've said here today and shared with us. And I'm just wondering, as we kind of wrap up, to look at, is there anything that you maybe want to share, like any final thoughts about nursing or wellness that we didn't touch upon, or even your career that you would like to share with us?
Well, I guess to tie things up again, I want to thank anyone and everyone who's been watching and listening with us. Your feedback and kind of like your comments has been really helpful, and again, it's such an honor to be here. And again, in a million years, if I was gonna tell my 17-year-old self that I'll be here today, I'll be. I don't know if I'd believe it, to be honest with you, but it's one of those things where again, it's not about you know the fallback, but it's about the comeback that matters,
Mm.
right? And so I always try to encourage people. So don't get discouraged right away. Understand that no one is perfect, even though you might see us and you think that we all have our lives together. Behind the scenes, we probably don't. Most likely we have other things that we are all going through, and that's okay. And I want you to know that. With that being said, it's all a matter of how we choose to kind of overcome those adversities and not let those define us.
I have to say we are, and I'm sure there's many people who your followers and people that are listening to us today are so grateful that 17-year-old you did not give up and chose a different path, whatever it may be. But maybe it will be in fashion someday, so maybe we will be wearing your clothes. However, we're just so happy because I think you really are making a tremendous impact in just having the brave conversation to
Mhm.
talk about our mental wellness, and we so appreciate you for being with us today and sharing and taking the time. But where can we find you? Where can people find you? How can we follow you?
Yeah, so if anyone who's watching has an Instagram, or if not follow me, you can follow me through my handle, Dr. Jonathan V. Yamis. Maybe we can put it in the comments there, and they can kind of follow the hashtag. They can also follow my mental health brand. It's called Mind and Heart Official. I can also maybe type it in here as well. And then if you have a LinkedIn, again, it's pretty much LinkedIn, and then / Dr. Jonathan V. Yamis, and they should be able to find me.
Awesome. And we want to thank all of you who wrote in the chat box and their comments, and you've had some great suggestions for all of us to look at regarding, how do we engage and advocate for ourselves in the workspace when it comes to vacation time, when it comes to HR. It is just been, and having a great support system. We really appreciate you engaging with us today, and really engaging with Jonathan as we share. Again, we are Fifth Window. You can find us at fifthwindow.com. You can follow us on Instagram. You can follow us on LinkedIn, where you can also view this again if you'd like to rewatch our spotlight. But again, on behalf of Fifth Window, thank you so much, Jonathan, for joining us. And Charlene, thank you so much for this morning being with us as well.
Thank you, everyone. We'll have a lot more spotlights to come for this year, so definitely stay tuned. And thank you again, Jonathan, for coming and joining us this morning. Thank you so much, Kathy, for hosting. And thank you all, and we'll see you during the next one. Bye, everyone. Have a great rest
Bye.
of your day.